Are you losing a lot of hair? Here are 7 possible reasons why. Excessive hair loss is a common problem that can affect both women and men of all ages. Hair loss occurs when the scalp and the hair follicles suffer some type of alteration. This may be the result of an illness or certain changes in the environment. It's common to lose between 90 to 100 hairs every day. However, many people lose so much that it can be noticed in the thickness of their hair. The problem is that some people ignore hair loss when it first starts and don't think about the reasons why it's happening. Because of this, it's vital to find out what the causes may be to choose an appropriate treatment. In the following article, we will address the causes so that you're able to identify and analyze your case. Protein deficiency. Hair is composed mainly of protein. Because of this, a protein deficiency in the body is partly responsible for hair weakness and loss. This is due to the fact that the body starts to ration the small quantities of protein that are left. This stops growth and weakens the hair. Advice. To maintain healthy, thick hair and reduce loss, be sure to consume the following foods: lean meat, seeds, nuts, dried fruit, legumes, avocados, dairy products, eggs. Excessive use of chemicals. Chemical cosmetic treatments are typically used to give a new look to hair or even to treat dryness and split ends. The problem is that many of these products use harmful substances. After time, these cause irreversible damage that cause hair loss. Hair dyes, treatments to bleach hair, and some shampoos tends to cause changes in both your hair and scalp. What should you do? Use masks and capillary treatments with natural ingredients. Thyroid conditions. Hyperthyroidism as well as hypothyroidism can cause hair loss due to the changes in hormones that the thyroid causes. These conditions manifest themselves in various changes in the body. If these changes are not addressed, they can cause severe consequences. What should you do? If you suspect these changes, consult your doctor for a blood test to measure what effects the thyroid may be causing to your hormones. Hereditary factors and hair loss. Sometimes, hair loss is not caused by a specific condition or illness. The bad news is that treatment is more difficult in these cases because the condition is a question of genetics. If this is the case, hair loss that occurs after 20 years of age can become worse. What should you do? Consult a doctor to determine if inherited genes are the cause of your hair loss and decide on a course of action to decrease it. Anemia. Anemia occurs due to the lack of iron. This is a mineral that is essential to the production of red blood cells. Having anemia is an indication that there is not sufficient hemoglobin, and because of this, it's difficult to transport oxygen from the cells to the body. One of the principal effects of anemia is hair loss, which will improve once the condition is treated. What should you do? Increase the consumption of foods rich in iron and adopt a recommended treatment by a specialist. Ovarian polycystic syndrome. For women, there are hormonal conditions that can cause hair loss. Ovarian polycystic syndrome is one of the conditions that provokes severe imbalances in hormone levels. This also causes weakening of the scalp and hair. A woman with this affliction should be under the care of a physician since it can cause infertility. What to do? Consult a doctor about any hormone imbalance. Acquire treatment to strengthen your hair to minimize the negative effects of this condition. Stress. Mental and physical stress is a common cause of hair loss. It's easy to ignore the effects, however, since the reactions produced by the body cause other problems that require greater care. What to do? Practice relaxation exercises and try to avoid stressful environments. Is your hair loss caused by one of these ailments? If you're losing a lot of your hair, consult a doctor and begin an effective treatment now.